Recently, 10,000 researchers met for the annual Alzheimer's Association International Conference. Jim Herlihy with Alzheimer's Association Colorado chapter was there to see what is being done, the research that's happening right now. He's joining us this morning. Thanks for coming in.
My pleasure.
This is really interesting. So this event was, it's a really big deal. Well, all these researchers come together and talk about Alzheimer's advancements and that kind of stuff. What's the biggest takeaway this year?
Well, there's a couple of major developments. One is a new medication, donanemab, and that is the third FDA-approved medication, and it is the latest in terms of effectiveness. And what they saw was that after 1 year, this only applies to people in the very earliest stages of either dementia or mild cognitive impairment, which is a precursor. But for those people, in the first year, 47% showed no progress in their dementia.
So it stops the progression of it.
Well, let's just, yeah.
Okay.
It may be too soon to know that it has stopped it, but we know that maybe the progression is so slow that it's not measurable.
What about the side effects? Because some of the ones that we've talked about that the FDA has approved talked about like brain swelling or brain bleeding. Is that in this as well?
That is a side effect of all, these are all very similar medications.
Okay.
And so that is a risk. And that's why people who were diagnosed who may be candidates for this should talk to their doctor, because there can be other medications that have conflicts with this, with this lecanemab or donanemab, any of these medications. So they should understand what the risks are. But the reality is, this is disease in the 117 years since it was first diagnosed, no one has survived. There's no one been cured. So there are risks with any medication, but it's important to understand what they are.
Yeah. So let's talk about some other things besides the medications. Talk about the hearing aids that have an impact as well with Alzheimer's. There's
been a lot of discussion in the research community about whether it's correlation or causation. Hearing loss has been associated with dementia, but it's not known if one causes the other. So this study looked at people who were in early stages of hearing loss in various levels of risk for dementia. And what they found was use of hearing aids cut cognitive decline by almost half.
Really?
in part of this study group. Now we know that about 2/3 of the people over age 60 are living with some level of hearing loss. So if you can reduce the hearing loss, there is, and again, this is all under research, but whether improving hearing keeps people better engaged, involved with their families and friends, so that maybe they don't go into the isolation that comes with Alzheimer's.
Yeah, the research is so fascinating to me. Also talk about advancements in the blood testing as well.
And that's really fascinating because half of the people with Alzheimer's have never been diagnosed. So getting a diagnosis is the key to being able to take any of these medications. And so what we found was this blood test, and what's fascinating is it doesn't require refrigeration, no special conditions. It's like a finger prick blood test that a diabetic would take every day. And they can send these blood tests, these little tabs in for examination, and what they found is that they are actually more effective in terms of being recognized and able to recognize the symptoms of Alzheimer's than the family physician. They were about 85% right versus just over half for physicians. So being able to do this certainly increases the opportunity for people who live in remote areas, rural areas, people who can't get out of the house can just do this and send it in and be able to get enough information to know whether they need to go see their doctor.
Well, millions of Americans suffer from Alzheimer's, 70,000 plus in Colorado. The research is so needed, the funding is so needed. So what's kind of your biggest takeaway when you walk away from these research conferences?
We are making leaps and bounds in progress. In just a couple of years, we've now had 3 medications that have been proven effective in altering the course of the disease. We don't have a cure, we're still looking for that, but we're making progress towards that, and then in being able to diagnose it so that people who have the disease can get the right kind of treatment, and the families can make plans for the kind of care that they need to be able to provide.
It all seems very promising. Jim Herlihy, thank you so much for coming in. Really appreciate it.
My pleasure.